Hello, and welcome to today's topic. Today we're discussing a life-saving topic, the 10 early signs and symptoms of stroke you should never ignore. Recognizing a stroke early and getting immediate medical attention is crucial for improving outcomes and saving lives. Remember, time lost is brain lost. The faster someone experiencing a stroke receives treatment, the better their chances of recovery. Let's discuss and empower ourselves with the knowledge to act fast and potentially save a life. Have you ever felt like one side of your body just couldn't cooperate? This sudden weakness or numbness, especially when isolated to one side, can be a major red flag for a stroke. A stroke is like a traffic jam in your brain's blood vessels, cutting off vital blood flow and oxygen. That's why you might feel weakness or numbness on one side of your body. Communication is something we often take for granted. But imagine waking up and struggling to find the right words, or your speech becoming jumbled. Our brain has specific areas responsible for language processing and speech. When a stroke affects these areas, it can lead to aphasia, difficulty speaking, understanding speech, reading, or writing. Our vision is precious, and sudden changes in our ability to see should never be taken lightly. Sudden blurriness, double vision, or a temporary blackout in one or both eyes could be warning signs of a stroke. When a stroke occurs, the areas responsible for vision can be affected, leading to these visual disturbances. Seek immediate medical attention if you experience these symptoms. We've all felt a little dizzy or off balance at some point, but when it hits you suddenly and intensely, especially without a clear explanation, it's crucial to pay attention. A stroke affecting the cerebellum can lead to a sudden loss of balance, feeling unsteady, or experiencing vertigo. Headaches are unfortunately common. But have you ever experienced a headache so severe and sudden that it makes you stop in your tracks? This is not your average headache. This kind of pain, often described as the worst headache of my life, can be a telltale sign of a hemorrhagic stroke. If you or someone around you experiences a headache this severe, especially with nausea or vomiting, call 911 immediately. Our brains are incredible organs responsible for our thoughts, memories, and ability to process information. When a stroke strikes, it can impact our cognitive abilities, leading to sudden confusion or difficulty thinking clearly. These cognitive changes can be subtle or dramatic, but they're important signs that something's not right. Our faces are incredibly expressive, reflecting our emotions and thoughts. But when a stroke occurs, it can affect the muscles in our face, leading to facial drooping. One side of the face might appear to sag or feel numb. If you ask someone to smile and one side of their mouth doesn't move as it should, act fast. We all experience fatigue from time to time. But when fatigue hits you suddenly and intensely, seemingly out of nowhere, it's important to pay attention. This kind of fatigue, especially with other stroke symptoms, can be a sign that your brain isn't receiving the blood flow it needs. Swallowing is something we do without even thinking about it. But when a stroke occurs, it can affect the muscles we use to swallow, leading to difficulty swallowing, also known as dysphagia. Have you ever experienced that pins and needles sensation? When it occurs suddenly and intensely, especially on one side of the body, it could be a sign of a stroke. If you or someone you know experiences any of these symptoms, act fast. Remember the acronym FAST: face drooping, arm weakness, speech difficulty, and time to call 911. Time is of the essence when it comes to strokes. Early medical intervention can make all the difference. Don't hesitate to call for help even if the symptoms seem to come and go or aren't severe. It's always better to err on the side of caution when it comes to stroke. Thank you for tuning in. Don't forget to like, comment, and share this episode with your loved ones. It could save a life. Stay informed, stay proactive, and stay healthy.